My name is Corey. This is my patient, and today we're going to do an exam of the thorax and lung. First thing we're going to do is just a general inspection or observation. We can look at the lips and the hands for any cyanosis. When it comes to the hands, we can look at fingertips looking for any clubbing, which could indicate COPD. And we're also going to look at the color of the nails and skin. Any yellowing of that could indicate lung issues or possibly nicotinic staining with smokers. Next thing we're going to do is look at the trachea and making sure that it is midline and it doesn't deviate to one side or the other. We can test this by doing a tracheal tug test, and what we're going to do is going to put my middle finger here on the trachea. I'd have the patient breathe normally, and then I'd have them swallow, and I should not feel any deviations, and it should stay in midline, and I should also not feel a tug. If I feel deviations, it could indicate atelectasis if it is deviating towards that side, or if it's deviating away, that could indicate a medial sinus mass, and a few other things. Next, we're just going to observe the breathing patterns of the patient. So we can do an A to P view, a P to A view, and a lateral. And we are just making sure that everything is symmetrical and in line. Looking for any signs of bradycardia or tachycardia, or any obstructive breathing patterns. Normal patients should have approximately 12 to 20 respirations per minute. We can check this also by doing a posterior palpation, and what we're looking for here is that we're going to grab around the 10th intercostal space. Thumb should be approximating, and we can instruct the patient to breathe in and out, and my thumbs should separate. And if my thumbs, it should be separated over about 2.5 inches. Anything abnormal would be less than that, and if it expands less than an inch, then we could be looking at ankylosing spondylitis. We can do the same thing here. Here at the subcostal margins, also have the patients breathe in and out and making sure that my thumbs, or taking note of the distance that my thumbs would separate. Next, what we could do is compare the anterior and posterior patterns of breathing. So I can put a hand here on top of the sternum on the sternum, my other hand in the back, and I have the patient breathe in and out. Next, we can do some percussions. So we will do that in a ladder formation. We can start on the posterior side, and I will start 2 hands here. I'll just place my fingertips on the upper thoracic spine here, and I'll start palpating. So what we're going to actually do is go from right to left in the ladder formation, listening for any abnormal sounds, and normally you should hear a resonance. We could also do that here in the front here, which would be here. And again, we want to hear a resonance. We don't want to hear any dull sounds. That would indicate something abnormal. Next, we can do our tactile fremitus. So on the posterior aspect of the patient again, I'm going to, and once again, use the ladder formation here, and I'm just going to place them side by side, and I'm really comparing the vibrations when I have this. So I would actually have the patient say 999 every time that I move to the different direction, or I'm advancing down the spine here. So I'd have them say 999, and we would do that. These vibrations, they should be symmetrical, they should feel the same. If there's an increase in vibrations, that would be a sign of abnormalities.